here. But at any rate, I should tell you the thing about Dr. Watts. And I remember back in '85, I watched with interest the way he took care of his patients, the way he served them. That hasn't changed. He still is that kind of a doctor. He will listen. He has that real ability to listen to what his patients have to say, rather than starting in and telling you what he can do for you. He wants to know what your problem might be. And so that will give you an opportunity to let him know whatever health issues you're concerned about, and together you can work out what is the best way to approach that. Dr. Watts said, you can tell, I'm not going to go through all of his educational benefits and all that sort of thing. You can read all about him. He's been in practice a long time. He's a delightful gentleman, easy to talk with. He has a wonderful wife, 2 children, and grandchildren. But I'm not going to let him talk about the grandchildren, or you'd be here all night, believe me. But I do want you to have an opportunity to listen to what he has to say tonight. And with that, it's my pleasure to introduce Dr. Dan Watts.
Thank you. Yeah, well, welcome everyone. And wow, it's pretty good to get you out of that kind of weather. I'm sitting there trying to get myself some sun outside. So we're going to be talking about hormones, especially bioidentical hormones. How many have heard of bioidentical hormones? How many? Okay, most of you. What have you heard? Anything good, bad, what? Good. Good? Anything bad? Controversial?
Bad.
Nothing bad? Okay. Anybody? Okay, so we're going to be talking about that. Actually, there is some controversy. In my own bias, it's pretty much all good, but you know, that is my bias. But I want to go over all the literature. We want to see what Yale has, what does Harvard say, what do all the centers of excellence say about bioidentical hormones, and then we're going to be talking tonight about a little broader subject, and that is keeping ourselves healthy as long as we can. So living a high quality of life for a long period of time. I don't think any of us wants to get out there in our ages and not have all our faculties there, so not be able to do things. So we're going to be talking about how does that, how do bioidentical hormones add into that? So we're going to be looking at that. Along the way of what I feel like is some of the, I'll call it the 4 cornerstones of health, or keeping yourself healthy. Bioidentical hormone balancing is one of the top ones. It keeps your energy and sexuality, endurance, bone strength. We're going to be looking into that. Nutritional health, so how does your diet, supplementation, physical conditioning, and toxin elimination. All these things we're going to be, actually, we have lectures on all this. Tonight we're just going to be talking about hormone balancing, but we want to look at all this. Along the way of bioidentical hormones, this is the 7 dwarfs of menopause. Itchy, bitchy, sweaty, sleepy, bloaty, forgetful, and psycho. I know this is on Facebook, and my wife's probably watching, and her sister's back there. But my wife actually probably had all these things at one time. she would tell you, you know. So I've seen this from, you know, right face up. It was kind of an interesting day when she woke up. She's, you know, and she says, I hadn't slept all night, and my hormones are off. And I went, well, go see your doctor. And she said, you are the hormone expert. You take care of this one. You know. So what are hormones? How do they help us with age management? What are bioidentical hormones, and what's the difference between that and synthetic types? And then what about testing? So we're going to look at, a lot of this is designed, I see a lot of guys in the room, a lot of this is designed for females, but we're going to see some stuff for guys too along the way. So let's look at aging and biomarkers. Biomarkers are kind of like health markers. They're nothing, as far as subjectively, there's nothing complicated about it. How do you feel? How's your brain working? How's your energy? How's your strength? How's your sexuality? How are you sleeping? These are all markers of aging. Then there's the objective part. This is what your doctor might measure. You go to a doctor, you might get your blood pressure measured, your weight, your cholesterol numbers. These kind of things are all biomarkers. There's actually thousands of these biomarkers, okay? So these would be measured, and as this goes up, the biomarkers go up, this would mean that you're getting healthier. You're more vibrant, okay? This is the length of time and age, okay, in years. And then we have a curve. Usually you start off a little bitty baby, can't do much on its own, you know, it's not, it's healthy, but it can't do much, right? It usually goes up along this curve and it gets up to here, and then all of a sudden it slips off. That's called going over the what? The hill, the cliff. When you said the cliff. Sometimes it is a cliff, maybe. Okay, going over the hill. So you usually get up to a point, and then you start slipping down the hill. It's interesting where that hill occurs because most people don't know that exactly where that is. It's different for males and females. Males it occurs earlier. Females later. Where would you say that occurs for males? It's very bad. Huh? 18 is exactly right. Okay, that is actually perfect. Okay, and for women, 25, 30 is actually, yeah, somewhere around in that era. So we tend to reach the height of our vibrancy or athleticism at around these ages. And then we start heading down, okay? We can go down this way, all right? This is a very poor way of going. These people have very poor health. It starts earlier in life. And look at this line here, this dashed line. You see this? This means that you start becoming real poor health. You start getting on medication, you start having a poor lifestyle, you don't feel good, you take a lot of medicine, then what happens? You die earlier. This is not where you want to be. You increase that length of poor health, right? This is about where most of us are, right here on this average line. Most of us will live into our 80s, early 80s, that's about average. We'll start having trouble in around our 70s. What's that? High blood pressure maybe, arthritis, maybe have a procedure, it's surgery, right? We have that procedure, okay? This is where we'd like to be. This is where we aspire to be. This is what I try to teach, is how to get up on this line here. This is a person who has very good health for a long length of time and doesn't have much decrease in the curve. We all go over the curve, we all go down, and then we all, die, right? Okay, sorry, it's the bad news. But look at this line here. Look at this line of poor health. These people live a very long time at which they have very high quality of life in a very short time at which we have poor health. That's about what we can try to get. One of the questions people ask me, can you make it, if you're on an average line, up to one of this line here? And the answer is absolutely yes, you can. One of the things we're going to talk about tonight, how can we have bioidentical hormones help us reach this line right here, okay, have a high quality of life. Now, one of the things I do want to point out, there are none of you on this line here. None of you. You know why I know? These people do not attend health lectures. They're sitting at home watching reruns of The Simpsons or something, eating Cheetos and drinking beer and wondering why their life isn't turning out good for them. But nobody's in here. Most of us are on this line here. Maybe some of us are even up here. Okay. So this is a timeline of a disease. This is a well person. Okay. Fit, energy. Okay. Eventually you might start having early symptoms in life, and eventually we end up in the disease state, cancer, diabetes, Alzheimer's, heart disease. This is where we don't want to go, okay? We know that in traditional medicine anyway, that our lab test will not usually tell us or identify whether you have a disease until pretty late on in the condition, around 80%, right around this line right here. So we can't identify in traditional medicine a disease problem until you have it. Odd, okay, but that's the way we are. You had a heart attack. You have Alzheimer's. Oh, you got cancer. You see what I mean? So this is the way we're used to diagnosing and treating conditions, okay? In integrative medicine, or the medicine that we practice here, we try to find the symptoms and signs earlier on in that and try to prevent them. So we talk about trying to find the symptoms and signs before they happen, and so that you don't get up over here, okay? So what might you look at in this area? What might we run? Anybody want to gather what we might look at? There's plenty of preventative. Hormone would be one. We're going to talk about that. How about if we found if we had any nutritional problems, or if we had any toxins in our body? Or what about our genetics? Everybody's using genetics now to try to figure out how do we change our genetic pattern and our risks for certain disease patterns. And there's all kinds of genetics going right now. So if we look at some of these earlier on in our disease state or in our state, we can actually prevent this, okay, from happening. So we now have the tools to detect and correct most of the problems that we have in life, and we can help ourselves go up on that upper line right there. This would be what it would look like in pictorial, okay? This is quality of life. It's that same scan. This is age. Look at this person. You usually get up and going good. Now, interesting that you said 18, because that's very good. Have you been to one of these seminars? That was very good. Most people actually will say somewhere near 30 or 40. That's when they say. Most people don't feel going over the hill until about that time. So we have a sense of things. See, these are growing up, okay? Here's Julia Roberts. I think she's around 45 at that time, okay, when she did this picture. Here's who's this?
Tina Turner.
Tina Turner. This was done recently. She's 75 in this picture, okay? She is doing Proud Mary on television, okay? I can tell you. She's going crazy, you know? This is Lillian Vernon, okay? She retired last year. Whoops, now why am I doing that? She retired last year, okay? This is her at 85, okay? She's running a Fortune 500 company right here, okay? And this is Jean Calmet. Anybody ever hear of Jean Calmet? Raise your hand. Huh?
She an actress?
She wasn't an actress, no, but she was French, okay? She has one of the longest longevities that we know, okay? She died at 128. This is her, I think, at 16. And she died not too long ago. But the craziest thing is, you got to look her up on YouTube. Jean Calmet. Watch her playing tennis at 115. I'm not kidding. She played good, you know. She played really good. Look at the difference here, okay? If you start down here, this is a person, look here, in their 30s, starting to head down, okay? This is a person in their early 70s, and they're totally invalid. Okay, check it out here. See this? With Tina Turner, 75, going at it on the stage. Okay, see, so we can start seeing it in pictures a little bit easier, a little more dramatically. Okay, now a lot of times this is not choice. Okay, I can't say we don't know these people's history exactly what happened, but for a lot of times it is choice. It is the choice that we do. So the things the things that we do every day make a matter in our health. Okay, practices. We do the good things that we do right. We will usually end up on that top curve. This is back to the same thing, hormone balancing, fitness, okay, nutrition, detoxification. I practiced traditional medicine for years. I was a general practitioner, I was an ER doctor, I was a general surgeon, I was an OBGYN. I practice now integrative medicine or anti-aging medicine for the last probably 20 years, okay? Which do you think is the better medicine? Which is the better style? Huh?
Second one.
I'm sorry?
Second one.
The second one, the natural medicine, okay? Anybody else? Traditional. Okay, we actually like both of them. Okay, if you have some emergent thing, cancer for instance, or you have appendicitis or something like that, I'm not going to sit around and try to get vitamin A or something like hormone balancing to work for. So, working with all those modalities, and what we try to find is I would say the most conservative thing that we can find that helps the person with that condition. It's better always, as you said, to prevent things, right? If we can, but it's good to be able to use both. So I'm able to put both of the natural and the traditional medicine in together, and that's called integrative medicine, okay? And so that's what we practice here. Let's look at hormones. Hormones are messengers in our bodies. They come from glands. A lot of people say, well, there's estrogen, right? And that's testosterone for males. Those are two hormones, but there's thousands of hormones. There's hormones in our brain, pituitary gland, the thalamus, hypothalamus, there's in our thyroid, it's in our adrenal glands, it's in our fat tissues, okay? It's in our gonads for sure, okay? Our stomach has a lot of hormones in it. So, and we're learning now how all these communicate and send messages around the body to help us have health and well-being. So they enter our bloodstream. They run by a lock and key method. So almost all hormones have a hormone that comes from a gland, comes down to a cell, okay? Biochemically, they lock into a receptor site, and they cause a reaction inside that cell. It can go even further into the DNA, okay? But that's kind of a simple idea, and they lock. And that one key fits that lock and turns that on. It has to be an exact copy of that lock, okay, that key, or it will not work. It won't work effectively, okay? So they turn on the switches that regulate our overall health and well-being. All hormones, all those thousands of hormones, all around the body. Imbalances in hormones affect our mental capacities, our sexual health, our physical strength. We call these mostly what we call adult hormone deficiency. Now, why is that? It's actually not a disease, okay? We don't have a disease as we're getting older and then our hormones fall. What we're finding out is that as our hormones fall, we start getting aging. We start having the conditions of aging. So that's actually good news. If you can hear the difference on that. because we can actually check, we can correct our hormone imbalances, and then we can affect our aging process. So we find out that you have symptoms of aging because our hormones decline. And so by fixing those, we can help that. So we need to get them on to balance. So let's look at thyroid. How many know about thyroid? We've heard about, everybody has heard about, you have.
I have underactive hypo.
Underactive thyroid. Well, females have that more than males.
Hashimoto.
You have Hashimoto's, and that more than males also. So we know that females, okay, this lady has some, and most likely we have other people in here that have thyroid issues, okay, because it's very common. 9 times higher risk in females than males. Isn't that interesting? Okay. It's active as T3. In our office, we like to examine the T3 and reverse T3. A lot of the doctors like to do the T4 or use the synthetic thyroids. Okay, we use them all. Okay, but it speeds up metabolism. It stimulates energy. It controls your weight. When they're balanced, it improves your mood, concentration, warms body, stimulates fat burning, dissolves cholesterol, opens up arteries, improves blood flow, reduces risk of heart disease and cancer. Now, I put this up first because this is a non-controversial hormone. When I first started practicing medicine, almost 50 years ago, we were using thyroid. It wasn't an unusual thing. We were using natural thyroid, interesting. Lee and I would examine the thyroid gland, would take a person's temperature, and that's about what we had. We had that, and we did fairly effectively. We found out that we could clear up a lot of thyroid problems with just plain iodine back then. So goiters, things such as that, or thyroid nodules, we were able to give that. When they're deficient, you feel cold, fatigued, depression. If you've had this, you probably know everything we're looking at. Dry, thinning hair, cold hands, feet, weight gain, painful joints, might feel better after exercise. This is actually a symptom of thyroid problems. Now, isn't that an odd one?
Wow. That's odd.
Why do you think that is? You might want to gather, except this person back here.
Circulation issues?
What?
Sounds like circulation issues.
Yep, that's good. That's increasing circulation.
And when you exercise, don't you release hormones?
You do.
Right.
So that pumps, flows, we call it flowing hormones.
Mhm.
That's very good. Good crowd. Anything else?
Could be dietary,
What's that?
dietary nutrition.
Dietary nutrition. We're talking about why would exercise, how would you feel better if you had hypothyroid? Why would you feel better? Okay. Exercise warms the body. Okay. One of the things that thyroid does is warm the body, so it keeps our enzymes working correctly. Our enzymes are tacked on to work at around 98 degrees. When you get thyroid, people will fall around 96, 97. Most everybody, it's one of the ways, remember I said they took the temperatures, and they'll run about a degree or two lower if their thyroid's not intact, okay? And so when you exercise, okay, it warms your body up, and all of a sudden, people come in and say, I feel better for about an hour after that, and then all of a sudden it runs back down. It's just almost for sure, I can tell you, that you're having thyroid problems. I actually had a lady that came in to see me. She had every single thing that was on here, every single one. And I said, what do you do? What do you like to do? And she said, well, I like to get out and mow the lawn in the middle of the summer.
Oh, my.
Yeah, running your thyroid, lady, and for sure she had hypothyroid. Now, unfortunately, she doesn't like to mow her lawn much anymore. But we corrected her thyroid problem. Progesterone is primarily a female hormone, but it's also found in males. It protects the prostate gland in males. So a lot of males with benign prostatic hypertrophy, with an enlargement of the prostate, we're able to help them, okay? The progesterone affects moods, it regulates menses, it maintains sugar, burns fat. It's a natural diuretic, okay? A lot of women, if they get toward the perimenopause, because see, in males, we tend to go up, remember we go up and then our hormones start falling. Hormones start falling, the testosterone around 35, but it takes a very slow drop. On females, it's like, it goes up and down toward around the 40s, and then one lady said fall off, what did they say, fall off the cliff? Because it can feel like that, right? And progesterone is one of those main things. It causes those fluctuating hormones, and we see that in perimenopause, we call it, or right before the menopause happens. It has a calming effect, and especially restful sleep. We find one of the first symptoms of putting a person back on progesterone is that they start sleeping well. We'll tell them usually within about a week or two. They should notice that. Preserves normal breast, uterus, prevents cancer. When it's deficient, it ends to PMS and depression. We see this every day. Heavy bleeding, I had that today, had both of these together, okay, today, new patient. Bloating, weight gain, fluid retention, irritability, insomnia, endometriosis, fibroids, adenomyosis, and cancer, okay? Uterine
What is
cancer.
adenomyosis?
Adenomyosis is like endometriosis inside the uterus.
Oh.
Yeah, it's fairly common. Causes painful periods and heavy bleeding. Sometimes in females, yeah. Progestins and progestogens are not progesterones, okay? These are common in synthetics. They're common in birth control pills, synthetic type hormones, and when people will give me articles based on something caused cancer, or one of these hormones caused cancer or something, and I'm able to take a look at it, it's almost always one of these. This decreases cancer, okay, prevents it. These increase. Progestins have been known to increase cancer. Fournier did a study in Europe, in France, 82,000 women for 10 years, and found out these progestins increase cancer risk somewhere in the range of 60%.
Wow.
Okay? Whereas the progestins are the natural hormones, not. Okay? We do a lot of looking into literature. These are books that you can buy. Okay, this is from a friend of mine. She's a professor of medicine about women's hormones, and she has in here 1,000 references on what I'm saying here tonight. And so they're all from journals. They're all from what we call the journals of medicine. And so they're all, what's Yale saying, what's Harvard saying? You know, what is the science evidence based on all this? This is Keeping Abreast by a surgeon. He's a breast surgeon, Dr. Mahmoud, okay, and he's also professor of medicine. And he's talking about ways to prevent cancer, and he's talking about using natural hormones in his book. This is a book on testosterone syndrome. This is for males, reversing male hormones in menopause. So these are all books that are available. There's plenty of reading. You can look at PubMed. You can look on the internet. I mean, there's no place you can't. We can look on the signs as you're going down the street. You know, so you can see these things all over the place. So a lot of times women will come in and they're having a lot of anxiety or nervousness or, like we said, sleep problems. They can't chill out. It's hard for them to chill out, relax, and cut off the chatter in their head. We find that progesterone, a lot of this is progesterone deficiency. So we're not born with Xanax and Prozac deficiencies, okay? So, but a lot of times we find, and we have to use those things. By the way, I'm not trying to say anything against people that use medication. I've used them. I've had anxiety and depression in the past, very severe, and have had to take medication in the past. Don't anymore, but I've been through that and know how that can be devastating to you. Estrogen is a female hormone. It's produced in the ovaries, but it can be produced in the fat cells of the body. So we see some men, if we get too fat, we'll start producing actually estrogens in us, and that is not too good for guys. We get boobs, we get hips, we start to go out shoe shopping with their wives and drink Chardonnay and quiche for lunch. It's really bad. Really bad. With its balance, it maintains feminine features, smooth, unwrinkled skin, positive mood, desire for sex and love, protects bones and brain and heart, supports immunity. When it's bad, it's really bad. Okay, what you say, falling off the cliff, right? Depression, hot flashes, hair loss, hair growth where you don't want it, fine wrinkles around the mouth, vaginal dryness, lack of sex, you'll desire, menstrual problems, lose your figure. Want to, again, separate the synthetic hormones from the bioidentical hormones. Bioidentical hormones are an exact match of that key. Remember we talked about the key that exactly matches, it's an exact copy. Let's just say what a molecule that God made, okay? That is what bioidentical hormones. So it's just like the hormones that come from the ovaries, come from the adrenal gland, come from the thyroid, come from the testes. So these all hormones can be matched, okay? And we find that these hormones seem to have extremely good effects on our body with almost no or very little side effects. They have to be watched by someone, okay? Because you can get some. We'll go into that. Pharmaceutical hormones, you'd have to wonder about that. They're chemically different. These are biologically exact. They're an exact copy of that key. Okay.
How was the copy?
I'm sorry?
How was the copy made?
I don't know. You know, I studied biochemistry, but I can't tell you to a certain point. But they can actually configure the molecules exactly. I really don't know exactly how they do that. These are started with soy and yam. They take a plant, and then they are able to configure that plant exactly like the hormones that we want to. Okay, so these start off, the Bioidentical is soy or yam products. Okay, you'd have to wonder right here, these start off as horse manure, urine, and kerosene. This is a one size fits all, so these are usually pharmaceutically given, so they packaged or put in pills or things such as that, you know, different ways at which pharmaceuticals deliver hormones. These are balanced individually. These you expect side effects. Okay, these are rare. These you increase inflammation. Inflammation, by the way, increases most of our problems. Heart disease, arthritis, cancer is an inflammatory condition. This decreases inflammation, soothes and calms inflammation. This increases blood clots. This does not. This increases cancer risk. This does not. This increases heart risk. This decreases it. Increases Alzheimer's. This decreases. Guess what? I was reading Dr. Bredesen's work on Alzheimer's, and he found out that taking hormones, just one hormone, okay, alone, estrogen for females, decreased Alzheimer's 30%. There's no pill that can do that. Okay, decreases that risk. Okay, all hormones in the range of something like near 50%. Heart disease, the same thing. Dr. Sinatra, Stephen Sinatra, if any of y'all follow him, have found out, he's a cardiologist, has found out that balancing hormones decreases heart disease. I think they had an article written on here. I don't have it here, but it's written in Circulation magazine, I think 2007, they checked 13,000 men, okay? And they found that if their hormones went down, they had a very high risk of having high blood pressure, high lipids, diabetes, cholesterol problems. And they balanced back the testosterone to help clear up those in the ranges of about 50%. So huge in cardiovascular, and this was printed in the magazine. And then if you look at some of the other books, this is a survey that was taken, and it's been done several times by some universities. This was done by Synergenics. It's a large anti-aging firm out in Nevada. If I could get my glasses out. Yeah, okay, here we go. And so what they did, they studied seniors, and all they did was they put them on hormones. They did some of our basic, what you call the big steps, okay? The 4 cornerstones stuff. They just used hormone balancing, exercise, and nutrition. And what they found was that the energy improved in seniors, 83%, memory 59, productivity 65. Now these are all, as we said, subjective. These are how they felt, okay? Strength 73, fat 68, lean muscle 73, libido 80%, sexual performance 60%. These are all, so facial appearance, skin tone, athletic performance, pain relief, better sleep, sense of well-being, and frequency of illness. So this is putting some of the cornerstones together. We find synergy when we work with all those. And that has been duplicated by many universities around. So see, what does it take to prevent or to help us with this? So see, that's what I'm talking about when I say it's a choice in many cases, okay? So not all hot flashes are global warming. Testosterone is considered a hormone of virility. It's actually important to men and women, okay? It does almost everything on here for guys and girls, okay? Exception a couple of them. It stimulates erection. Y'all don't have those parts, okay? And also the prostate, thick and soft, okay? So when it's deficient, you have low sexual desire for both males and females, weakened erection for males, prostate thick for males, fatigue, both. Memory suffers really bad. This is one of the main reasons that you get, a lot of women will tell me they get around 50, 55 right in that area, and they tell me, I can't do my work, can't compete with people. Remember, sometimes it's falling right off the cliff, okay? Depression, grumpy, flabby muscles, beer belly, soft appearance of hips and breasts. A little thing on me, I was probably, I guess 56, 57, or 56, I guess. And I remember I was not feeling too good. I gained a lot of weight. I weighed about around 230, I guess around that time. I had high blood pressure, my cholesterol was going up. I lost my energy, sexuality is just kind of like blue, you know. I've always been athletic, getting out, always doing stuff, but I like to just hang around, watch television, sit on the couch and stuff like that. I went to the doctor. He said that my low blood pressure needed to go on statins, something like this. And I'm going like, wow, you know, I must just be getting old. And then my wife told me I'm getting to be a curmudgeon. Curmudgeon, you see this? That is the definition. I had to look it up, you know, first, and I said, oh man, that's not too good. And so I actually started hormones then. It's been over 15 years since then. I feel better than I did then, okay? Which is unusual, right? Remember we talked about going down the thing slope and then heading back up. So I was able to have that, you know, by myself. So balance, you have sharpness of mind, especially mind. Mind is one of the biggest things for hormones. Remember I told you about Bredesen said that if you balance your hormones, it increases your brain. So that thought, that thought process, people will say, well, I have a sluggish brain. I can't keep up that foggy mind, okay? Stimulates the libido, reduces risk of heart disease, counters high cholesterol. This is what they found, remember in that article I told you about in Circulation magazine when they did 13,000 guys. Builds, tones muscles, reduces fat, stimulates hair growth, prevents joint and muscle pain. Really good, okay? Keeps you up on that line we're talking about. Human growth hormone is necessary for children to grow, but as we get older, it starts taking a dive, and it's one of the #1 anti-aging hormones, okay? When you get deficient, you have a sagging face, thin skin, less muscles, extra weight, fatigue, anxiety, depression, less resistance to stress, and feel incompetent. So serenity almost. When you have it balanced, it maintains muscles, reduces fat, provides energy, restores sleep, lessens anxiety, feels serenity and security, endurance, especially endurance. Athletes really love that. If you have any kind of older women or males that like to do endurance athletes that like to go out and do long hikes or bike rides or something like that, this is really good. Okay, they feel really big difference. Strong bones and joints, protects heart and brain and thymus. Okay, especially it's very good for, I would say, skin. Okay, a lot of people like it. I take growth hormone myself. Usually, you know, 72-year-old guy, you're not going to see that springy, that elasticity of the skin. It's going to stick up there. Okay, my skin just pops back so that all over the place, and that affects the tendons and the elasticity of your skin there. It's thickness of the skin and also the elasticity seems to maintain one of the things all over the body, including the fascia inside. And I don't know if everybody's been reading about fascia and fascial release and how do you keep the fascia moving, because if it gets stiff and dries up and then starts sticking, and we start having pain in our muscles and joints all over the body. Dopamine, acetylcholine, GABA, serotonin, there's 200 brain hormones, okay? They control your personality and mental capacities, mental capabilities, our body composition. How many have heard of these hormones? Dopamine, acetylcholine, okay, good. GABA, serotonin. Okay, serotonin's a joy hormone. It's pretty much, if you don't have serotonin, it runs down, we'll find out that some females, I'm picking on you guys, seem to have more depression, more rundown in serotonin than males, and end up on serotonin reuptake inhibitors more than guys. Okay, so Prozac, Zoloft stuff, you probably had some of your friends that are on some of these. When you, dopamine, you men run down on that one, okay? That's competitive drive. That, if we run down in that makes us kind of run down curmudgeonly, okay? I actually run a low dopamine level. I have to, I drink coffee. Coffee is a dopaminergic. It's like keeps you kind of revved up. And I drink a lot of donuts, Tammy. Have to start off with coffee. They know not to do that. My wife knows, don't get me started out there. You know, I drink about 2 cups before I get started in the morning. But you can actually take natural dopamine, natural acetylcholine is speed of thought. So when those nerves start slowing down, when that nerve conduction slows down, you start losing your thought. Okay, and that is one of the things that we find with Alzheimer's And many of your drugs that we use for Alzheimer's are acetylcholinesterase inhibitors. Acetylcholinesterase inhibitors. So they stop the thing that breaks down acetylcholine. Okay. GABA is a chill-out hormone, relaxing hormone, a resting hormone, a sleep hormone. A lot of your anxiolytics, Xanax, Klonopin, those are GABAergics. Your sleep meds are GABAergics. Okay, and whenever and then serotonin, everybody knows that that's like I said, the joy hormone. And a lot of people go on serotonin reuptake inhibitors. Okay, when they're good, you have good enthusiasm, confidence. Your weight's pretty much maintained. When they're bad, your weight gets off. You have anxiety, memory problems, and depression. So it's very important to keep the neurotransmitters or the neuropeptides or the brain hormones balanced. And you can run levels of this. We're going to show that in just a second. Cortisol is a stressor hormone. When it's balanced, you have good energy. It stimulates appetite, eases inflammation, it soothes allergies, and enhances our immune system. When it's deficient, it can get really bad. Okay, burned out, rapid pulse, painful muscles, joints, hives, allergies, flu-like fatigue, sweats, cravings, dazed, confused, hair loss. These people, guess what, feel worse after exercise. Worse after exercise. So if I see a person coming into fatigue, because you can see thyroid and adrenal or cortisol is very similar type symptoms. They both feel fatigue, they both have weight problems, you know. I ask them one question, what's that? Do you feel better after exercise? What am I gonna get? Got thyroid, huh? You're gonna feel better. Got cortisol?
No.
Worse. Okay. They don't have any exercise tolerance. They work out 5 minutes, 10 minutes, and fall or none. They can't work out any. So we'll see that. Does this woman have balanced cortisol or what? What do y'all think? Anybody want to gather a possibility? What do you think? Here she is. It's a pretty day. She's out working. Huh? What do y'all think? Huh?
Yeah, she looks.
You think she's okay? Yeah.
Might be calling her
Anybody
doctor.
want to? Do
Might be
what?
calling her doctor.
I was able. Y'all can't see it. I'm able to get up, and she is actually talking to her boyfriend, and they're talking about a vacation.
Oh.
Not all as bad as it sounds. I can't see that. I don't even know. So it causes fat. Okay, cortisol will cause fat. Everybody knows that. Causes visceral fat, so you get almost a beer belly look. Estrogen dominance, males and females. It increases LDL, bad cholesterol, bad for your heart. Decreases thyroid, whether you have normal thyroid or not. It's not good. Okay, so you want to keep your cortisol in balance. These are some patients that I taken a look at. Let's see, this is I think she's about 50-year-old female. Her husband had her come to me because she was just run out of energy. Okay, just absolutely fatigued. I was able to talk to her. She said she'd been to her doctor. They'd run a full profile, the traditional profile, and he said, "You seem fine. Everything seemed fine." But she just couldn't do anything. She had a lot of trifid work, and she said it was just, I can't go back into work. She laid there in the seat and just slumped over, and that was it. You know, couldn't go back in. So there's a lot of stress at work. That gives you clues as to what might be going on, why she's having fatigue, stress, fatigue. She gained some weight, right? Starting to sound like somebody. I ran cortisol level. This is the salivary level, and these little footballs right here are her spit. She actually spit 4 times during the day, in the morning, in the noontime, around afternoon, and in the evening. And we were able to collect these, and we were actually running her cortisol levels. So we were seeing how her adrenal gland was working. We found they're working very, very sluggishly. This football here should be way up here. This up in here. So they should be up on this green line. So your cortisol at night should actually go up. Kind of like a battery in a car. It should charge up. And it should charge, and you should have a nice charge in the morning, and then as the day goes by, it usually goes down, and then by the evening, you're ready to recharge again. You get to sleep. So people that are able to have, we call that a diurnal rhythm, or a rhythm that happens during the day, goes up, and then drops down. And hers was flat, gone. She doesn't have any cortisol. No wonder she couldn't go to work. It didn't feel like she could. We were able to help her. We got her on cortisol. Actually, we had to put her on natural cortisol. and then we were able to get her adrenals balanced. We got her some body and work. What we found out was they were bickering and fighting at work. And we got somebody to help them team building and all this stuff at work. And pretty soon she went off the cortisol and she was doing great. Okay. This is a guy, he's Jack. Jack was sent in to me by his wife, who said he is sluggish. He sounds like me, what I had. I gained weight, he wasn't feeling good. He used to be an outdoors guy. He will show a picture of him here in a minute. He's fine with it. He's the police or fire chief, and so he's fine with us showing that. Okay, but he's was not feeling good. You know, here he is, used to be a buff, robust dude. Okay, same thing I had. You know, and he had been to his doctor, cholesterol, hypertension. He just thought he was getting older. Told him he was going to be on diabetic meds if he didn't get things squared away. He said, "What's up, Jack?" He said, "Well, I don't know. My wife told me to come in here." I said, "Well," so we went over. Pretty soon he's telling me all these things that we went over, and he said, "Well, I just think I'm getting older." He was just 50 years old. Okay, and I said, "Well, let's run some hormone levels." And sure enough, he had terrible hormone levels. Here's his testosterone. It's 136. That L means low. I know y'all can't see this. 136 should be around 800. Yeah, his growth hormone's 131, should be up 350 right in that area. Okay, so he had no wind in his sail. He had no gas in his tank. This guy was run out of energy, chutzpah. Okay, go juice. He had nothing. Okay, so we were able to get him balanced. This is him in June. This is him in November. 5 months later, he'd lost about 50 pounds. Okay, he'd grown a little more of a beard. Okay, but he's filled his oats here, guys. Now, Jack didn't just go get some hormones, and that was it. Okay, Jack started what? Doing the other things, exercising and eating better, right? And he was able to lose a bunch of weight. I believe he is actually sucking his stomach in there, and he's feeling so good about himself. He's actually taking a picture of himself in a mirror here. So. Got his chutzpah back, right? This is Jackie. She's 37. This is a very common patient that we would see. Okay, divorced, dating, has 2 kids. She's a medical assistant. Has pretty good life choices, we'd call it. No alcohol or drug abuse. Eats well, exercises, takes multivitamins. That sounds pretty good. She wasn't feeling good though. Headaches, breast tenderness, weight gain, bloating, swelling, ankles, feet, food cravings, painful menstruation, emotionally a wreck, anxiety, panic, depression, irritability, guilt, decreased self-image, low sex drive, fatigue. Not good if you're dating, right? Not good at all for everybody. Her lab tests were bad. Her estrogen was way high. She had too high of estrogen, so you can have too high of estrogen. It was 186, shouldn't be, but about 80 to 100. Her progesterone was very low. Remember, we know something about progesterone. It helps us calm down, right? Her estrogens are high, it makes us irritable. Girls irritable. Testosterone's very low. Sex drive, right? Not her brain function would not be so good. DHEA, that's an adrenal hormone, is low, and her cortisol is low. She has everything here. Norepinephrine ratio. I didn't talk about this, but there's a ratio that develops between some of your brain hormones that causes panic disorder. Okay, and this is one of them. It has, so she would have floods of adrenaline. It would just open up and flood out. She would get panic disorder. Your heart beats real fast. I had those when I was younger. Okay, remember when I went on medication? Okay. Serotonin was very low. Should be about 200. Her was 90. The joy hormone. Panic attacks, joy hormone, and then her estrogen. She had what we call estrogen dominance. It's called estrogen dominance. We put her on something to drive down the estrogen. Okay. Put her on a little progesterone. Got her on something to raise up the GABA and the serotonin. Okay. I think she had, she had to go on Xanax for the panic attacks. Okay, so we had to use medication for a while, and we've seen her. She still carries the Xanax with her. I don't think she's used it in 4 years or so, 3 or 4 years, but she likes to keep it with her in case she has a panic attack or so. But she hasn't asked me for any more. So she was able to get hormone balancing and help her out. This is Shelley. She's 55. She has 2 kids, 1 grandchild. Had a hysterectomy. She has carb cravings, and she likes to eat fast foods and sugar. Okay, 2 drinks of wine a night. Exercises 3 times a week. Walks usually. takes some multivitamins, calcium. She tried Premarin, but she didn't like it. It made her bloaty. That's a synthetic hormone, by the way. I don't see that much anymore. Okay. The interesting thing is, they didn't try to hide the name. I'm going to show you what this name is. This is where they got the name. Premarin. That's pregnant horse mare's urine. I'm not kidding. That's where it came from. Okay. We don't use that. But anyway, she tried it. No doubt it wouldn't work so good, right? You got, so she had weight gain, 30 pounds in 3 years. Bone density was very bad, minus 3.7. Cholesterol was high. The good cholesterol was down. Bad cholesterol was up. Blood pressure was going up. She felt flabby, vaginal dryness, no sex drive. Emotionally also bad. Poor sleep, irritable, okay, tired at night, hot flashes, night sweats, couldn't sleep well. She woke up about 2 or 3 o'clock in the morning, and she had less mental focus and low energy. Sounds like what we've been talking about, right? I mean, you start getting the idea here. These are people we see all day long here, including myself, okay? Her estrogen was low. Remember we said 80 to 100, hers was 50. Progesterone should be 5 to 20, hers was, we couldn't calculate it. Testosterone was very low, should be around 60 to 70, hers was 20. FSH should be low, remember the one before this, should be around 20 to 30, hers is 90. Now, that's normal for menopause, okay? You usually get menopause, most females get around 52, that's about average. She was 55. She had a hysterectomy. That will cause a surgical menopause. Growth hormone was low. Insulin was high. When your insulin is high, it causes insulin resistance. We didn't go over insulin today, but that's a hormone. And then her thyroid was low. She had low thyroid. So, my goodness, you don't have to go too far to see a hormone problem here. Thyroid bad, insulin bad, growth hormone bad, estrogen, progesterone, testosterone, and adrenal gland. Woo! Okay. So we actually gave her growth hormone, we gave her thyroid, okay, started her on hormones. These are bioidentical hormones, okay, and just got her on some good nutrition and weight resistance diet, exercises. An interesting thing happened about 2 or 3 years after Shelley came back to us. We sent her over to get a bone densitometry. Is anybody used to reading bone density or anything? Or anybody know if I said a minus 3.7?
Yeah.
Would you know that's pretty low? That's osteoporosis, okay? She fell on this carpeted floor, she'd probably crack. That's bad, okay? Because she was very subject to fractures, back and hips. So the radiologist called me back and he said, you have to send Shelley back over. And I said, why? He said that, our calculations must be wrong. I said, oh, well, Shelley, they didn't get a good reading on your bone density. You have to go back over. She went over here to get her bone density. And so he ran again, and he called me back. He said, her bone density is normal. And he said, that's crazy, you know. Within about 3 years, she had reversed from a 3.7 to a normal. And we're talking normal for a 35-year-old female. Okay, so she had really gotten better. What we find is that when your hormones take a dive, you start getting demineralization of the bone. And that is one of the reasons. You usually don't get osteoporosis or osteopenia until unless you have a medical problem, until you stop having your hormones. Males have it also, but not as much. Our bones are much thicker than females, so she was able to. Anyway, that's really good. Well, we expect, actually, when you go on hormones, about a 5 to 7% increase about every 2 years in the bone density. That's without any bisphosphonate or anything to actually push it. So we expect that. So we talked about that tonight. Living longer, healthier, healing your heart, staying in the game, losing weight, protecting your brain, high performance, getting fit, having energy, slimming down, increasing endurance, okay? And we're talking about investing in your life. This is yours, okay? You have like a body here. You want to kind of protect it. Your body will be around a lot longer than your car or your house. And so we're talking about putting into it, both in money and time and exercise and things that you do every day, okay, to add to your body to help yourself get better, and you can do it. I'm going to be stopping now, Barbara, and Are we gonna be asking questions, or do you wanna?
Yes, go ahead. I would like for everyone though to complete their seminar evaluation form.
We want to say goodbye
But
to
we will do the
Facebook.
question and answer if you'd like to do that.
Okay, before question and answer, because I don't think everybody signed a release, so let me say goodbye to our Facebook people on here. So goodbye. Hope everybody enjoyed the conference. Okay.